of the coronavirus pandemic continue to increase, a certain group of people seem to be at a higher risk of developing serious complications should they contract the virus. People who suffer from various diseases, the elderly, and now smokers are at a higher risk of developing serious complications. Our reporter Paulette Mboga spoke to a pulmonologist, who explains why the report is voiced by our Dr. Mercy Korir.
Smokers, like people living with HIV, hypertension, diabetes, asthma, among others, have something to worry about during this coronavirus pandemic. Paul Gikonyo is a 28-year-old businessman in Nairobi who has been smoking for the last 3 years. Paul is taking the coronavirus seriously and taking measures to avert infection.
Nanitia changamoto niweze kujaribu nje yote taweza kunifanya niwache ndio pia nisipatwe na hiyo virusi ama pia niambukize walio karibu nami.
Vincent Mudenyo, on the other hand, is unaware of the link between smoking and COVID-19. At only 25, he has been smoking for the last 15 years.
Nimequit mara kama 3 nikirudia. This is the 4th time I'm quitting now, but now I think I'll make it. Nitaquit.
Dr. Jeremiah Chakaya, a chest specialist, explains that smoking introduces substances in tobacco that are toxic to the lungs and interfere with the normal functioning of the lungs.
As a smoker, you need to know that you are at risk of developing severe disease for a number of reasons. Tobacco smoke contains many things, and many of those things are toxic to the lung, and they interfere with the normal defense systems of the lung, especially a system that we call in our medical language the mucociliary escalator system. Now that's a big name, but all it means is that you produce mucus, generally speaking. All of us produce mucus in the lung. This mucus is used to trap things that get into the lung, and you move that mucus up and eventually you either cough it out or swallow it.
Smokers are more likely to contract COVID-19 because while smoking, their fingers are in contact with the cigarette, which constantly touch their mouths. According to Dr. Chakaya, there is no better time to quit smoking.
Smokers generally are known to suffer other medical conditions that could limit their lifespan. Cardiovascular disease, diabetes, cancers, all these are much more common in people who smoke. And therefore, this is an opportunity that one is being given to say, hey, there is corona, it might be bad for you, stop smoking now.
Nearly 5 million people, accounting for 13% of the population, are smokers. Even though it may take months for a smoker's lung to heal from damage caused by long-term smoking, Dr. Chakaya says that their health might improve, but at the very least, they should observe physical distancing.